Hello everyone. Today we are going to talk about something that might look cute and harmless but can actually be a major problem of your teeth. That is pulp stone. So what are the pulp stone? And you ask that there may be small hard deposit that can form inside the pulp chamber of your teeth, right? Next to the nerve. Let me tell you, there is no fun being having a pulp stone. So why do pulp stone form in the first place? Well, it could be due to variety of factors such as poor oral hygiene, trauma to teeth, or genetic factor. So what if poor oral hygiene? If you don't brush and floss regularly, bacteria can accumulate in your teeth and they may cause infection, caries that can lead to pulp stone or maybe a chewing habit. Trauma to tooth means maybe a chewing habit that is like chewing erica nut that injure the tooth means make a trauma. If you have injury to the tooth, it can damage pulp and cause a stone. Then genetic. Some people may have more prone to developing pulp stone due to genetic factor. So now the pulp stone can cause a lot of problems, including pain, sensitivity, infection, and tooth loss. So, main reason is pain. When you came to know that you having a pulp stone in your teeth. So, whether you are eating, drinking, just breathing, pulp stone can causes constant excruciating pain. Sensitivity. If you have a pulp stone, you may experience sensitive and stimulus to hot and cold drinks. Okay. Then infection. If the pulp stone left untreated, it can lead to infection which can cause even more problems. Then tooth loss. In severe cases, untreated pulp stone can lead to tooth loss, in which is definitely not something want to happen. Okay, so how pulp stone treated? Well, there are few different options, including filling, root canal treatment if necessary, extraction if necessary in severe cases. So, what are the fillings? In some cases, a filling can be used to remove the pulp stone. Means in pulpotomy cases, children's cases. Root canal treatment if the pulp stone is causing an infection, a root canal may be necessary to remove the infected pulp, that is the pulp stone. Extraction in severe cases if tooth is in not an condition to save, then we have to extract it. So how can you prevent the pulp stone from forming first place? Here are some things you can do: that brush and floss regularly. As mentioned earlier, good oral hygiene is the key of the prevention of the pulp stone. Make sure you are brushing and flossing at least twice a day, every day. Okay. Then visit the dentist regularly. Regular checkup with your dentist can help and catch any problem early as possible before they become a major issue. Avoid trauma to the teeth. Try to avoid injuring to your teeth. Okay, either by wearing mouth guard during the sport or taking any precaution. Then and that you have it flow. Pulpstone might not be the most glamorous topic, but it's important to know about them. So you have to take steps to prevent them. Don't let pain and discomfort take over your life. Make sure to take good care of your teeth and visit the dentist regularly. Thanks for watching. Myself, Dr. Rishikesh Kushalrao Lahane, as dentist, I should teach you and how to prevent pulp stone by forming. Thank you.